making health systems work for young people and adolescents in Uganda, also known as the E-Voucher project, directly contributed to the Heroes for GTA project, implemented in a consortium made up of partners, including AMREF, Cordaid, ICRW, and Mifumi. The main goal of the Heroes for GTA project was to ensure that all young people and women in 9 hard-to-reach districts of Uganda fully enjoy their sexual and reproductive health and rights, and live in a gender-equal society free from SGBV. A total of 2,678 girls and women benefited from the E-Voucher project, which was implemented in 4 districts out of the 9 implementing the Heroes for GTA. These 4 are highly burdened districts of Buko, Kwen, Budaka, and Namaingo.
We realized at the design of the intervention and through our consultations with young people that their access to SGBV services was being hindered by a number of factors, among which is affordability and confidentiality, which was at the time not as desired by the young people.
We realized that for us to improve access to SGBV services and SRH services or sexual reproductive health services, we needed to have innovations, a mechanism of innovating where we had a system of using e-voucher other than using electronic vouchers to refer.
So what we've done in our communities is that through the voucher system, survivors are linked to the different services, most especially the health service. So the survivors that can go through our advice centers, that go through our legal officers and also our social workers and other community resources are referred using a voucher to a health center where they can actually access free services adequately, timely, but also very appropriate services. So that has helped us increase the number of survivors that we serve, but most importantly, it has also helped us increase access to justice.
Through the Sauti Plus e-voucher system that we're doing with Cordaid, we've been able to actively contribute to programming, contribute to monitoring, and contribute to the learning.
The project worked to ensure that SGBV survivors had access to integrated SGBV services. In the 4 target districts of Eastern Uganda, Cordaid focused on a youth-led approach where trained peer educators were at the forefront of sensitizing fellow adolescents in the communities.
From the time we started, we've been able to change a number of youths because we've reduced SGBV cases which were rampant.
I went through the training. Also, as I came back, I started helping my fellow younger people to access services.
Ediamborati haba arohaka dihaya mberesa ninja mmatenet abasawo bambisya bulai ndebula bulai ndino mwana age bulai.
For us, we are almost their age mates. They feel free to share with us.
These people have really given us a light that we can freely express ourselves and get helped.
Sometimes they test us, they tell us what we are suffering from.
They have taught us about gender-based violence, how it is caused, to whom it is mostly concerned.
Within a few days, I went back to her. She told me the perpetrator was arrested and he was brought to justice.
How do we make sure that these issues remain confidential between the client, the health worker, and the peer educator? When that information is captured on the system, the Sauti Plus system, we always make sure that this information is only accessed by the richer hand administrator and the rightful person that Cordaid gives permission to access this information. Why? Because we want this information to remain confidential to the client.
With the RBF funding, Cordaid was able to extend youth-based activities at the health centers in the 4 districts. These activities have in turn made these adolescents change agents and they utilize their time constructively.
nindi ninjaba okwegaita ne group egindi embubi omukyalo nto banje abo bakunywa sigala njabe oba nyimbe munani kuiba bintu by'abantu.
The project also empowers service providers, health workers specifically, not only to deliver services, but youth-friendly services that are confidential, non-stigmatized, and respond to the very needs of the young people.
So we have really achieved a lot. We have really created demand for the SGBV services and SRA services in all the facilities we're working in.
With a voucher, nobody charges because there's no money involved. You know, you give me a voucher, I record it, and that's all. So there's no cash. In other words, survivors get timely services with just a card that they present.
The way the system is designed, it can be run by the health workers themselves. It has a window for sustainability. Once they own it, then we know that this is likely to have, it will likely to continue even after the end of the Heroes program.
Our key lessons learned of this project, and based on the accounts that we got from the women and the girls, is that when you offer integrated SRHR services combined with digital tools for youth to access those services, that gives them a platform to really increase their access and the affordability of those services. So keywords are affordability, youth-friendliness, and confidentiality. Bringing all these together in integrated services has really worked to help prevent sexual gender-based violence.